Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Types of hepatorenal syndrome. Hepatorenal syndrome can be divided into two types. Types of hepatorenal syndrome. We have two types of hepatorenal syndrome, type 1 and type 2. In type 1, there is progressive impairment is seen in the renal function. There is impairment is seen in the renal function and there is decreased creatinine clearance is seen in 1 to 2 weeks of presentation. Within 1 to 2 weeks of presentation, there is decreased serum creatinine is seen along with progressive impairment of renal function is seen. So this is type 1 hepatorenal syndrome. This type 1 hepatorenal syndrome will show poor prognosis in the patients. Okay, then we have the second type of hepatorenal syndrome, which is type 2 hepatorenal syndrome. In type 2 hepatorenal syndrome, there is decreased glomerular filtration rate is seen, along with there is one decreased glomerular filtration rate, and there is elevation of serum creatinine level is seen, but this elevated serum creatinine level is almost stable. It is not progressive elevation, it is more than normal, but it is stable. So this is associated with better outcome. So type 1 is there is reduction in creatinine clearance is seen within 1 to 2 weeks. That means definitely there is elevated creatinine is seen in the blood, and this is progressively it impairs. Slowly there will be increased, the severity increases slowly, whereas in type 2 there is reduction, but this is a little fairly stable. So that is the reason why there is good prognosis for type 2 more than type 1. Then, okay, a patient with hepatorenal syndrome. Hepatorenal syndrome is seen in patients with refractory ascites. Seen in refractory ascites cases, and for this hepatorenal syndrome, before we diagnose a patient has hepatorenal syndrome, we should definitely exclude other causes of acute renal failure. So this hepatorenal syndrome is a diagnosis of exclusion. Then diagnosis. The diagnosis of hepatorenal syndrome is mainly made with the help of the following. First, there should be the presence of large amount of ascites should be there in the patients with there should be a large amount of ascites should be there. That is one. Second, there should be stepwise progressive incidence of creatinine should be there. Two things. One, there should be large amount of ascites. Second, there should be stepwise progressive increase in creatinine should be there. And for the diagnosis of hepatorenal syndrome, we have International Ascites Club criteria for hepatorenal syndrome.
thank you and thank you for watching.